If you're having neck or back pain, we're going to talk about the difference between modern pain relief and old school pain relief. Stay tuned. Hello, my name is Dr. Brandon Pettke with Lone Star Progressive Medicine. And on today's video, what we're going to discuss is back and neck pain, old school pain relief versus modern pain relief. And I'm going to differentiate between the two. And maybe this is you and you've experienced that old school pain relief and you need something a little bit more modern, or maybe it's a family member or a friend that is experiencing this and you've seen them walk through this. And so I want to describe what I call old school pain relief. Typically what happens is somebody has neck or back pain, they've maybe tried some over-the-counter medications or different things at home and it's not really getting any better. So what they do is they go to their family doctor, their primary care physician, and they typically get prescribed 3 different things: pain relievers, muscle relaxers, and anti-inflammatories. And sometimes they work, sometimes they don't work. In many cases they don't, because you're not addressing the underlying cause. But the doctor says, hey, if this doesn't work, come back in about a week and we'll go to the next step. The next step typically at that point in time, if it hasn't gotten any better, is they refer you out to physical therapy. When you go to physical therapy, what's happening is they're addressing the muscles versus both in stretching and in exercise, rehab exercises, building up the strength of the muscles. What they don't address is several other components that I'm going to discuss on later on. If that still doesn't work, typically you do physical therapy for 4 to 6 weeks. That still doesn't work, then you go back to your doctor. They say, hey, let's send you out for some additional imaging. We'll take an MRI of your neck or of your low back. And from there, depending on the results of that MRI, they will send the patient out, you maybe in this case, for either pain management or sometimes even a surgical consult. And so with pain management, typically there's a number of different procedures that pain management doctors can do, but what they typically do is what are called epidural steroid injections, facet blocks, sometimes a nerve block. There's some other procedures as well. We won't go into all of them here, but if that still doesn't work and you went that route first, then the next step is a surgical route. And what I'm telling you is that there are some additional steps that individuals do not go through that can provide tremendous amount of relief. And so that's what I'm calling modern pain relief. And so I wanted to discuss that. First of all, a little bit about our clinic. Our clinic is an integrated clinic, and so what that means is that we basically take the best of traditional medicine, the best of alternative medicine, and we combine those two things together. And with that, what we found is better results, basically. Not only quicker pain relief, but also longer lasting relief. So here's what we do in our clinic. If the over-the-counter stuff, home remedy stuff doesn't work, typically we come in and we evaluate the patient and we combine these things. So what we do is we combine physical therapy along with modern chiropractic care, along with decompression therapy, which is a non-surgical treatment for bulging, herniated, and degenerated discs. We may even use kinesiotape, which if you've seen the Olympic athletes, they have the different tape on them. That's kinesiotape. We do deep tissue work as well. So we work out those tight muscles and any adhesions and scar tissue that may be in there. And then in some of those cases, we do need to incorporate some pain meds, prescription pain meds, or muscle relaxers or anti-inflammatories. But in our clinic, we can also do trigger point injections as well, so we can get the muscle spasms. We don't do that in the majority of the cases, but we have that ability in our clinic to do that. So if that doesn't work, which by the way, that works about 92 to 93% of the time in our office, then what we can do at that point in time is we can incorporate pain management, traditional pain management. And what that does is that takes us up to when we work in conjunction with traditional pain management, because we're taking care of the biomechanical dysfunction. So that means how the joints are not moving properly or the muscles aren't coordinating the movement properly. We're taking care of that. And when we do pain management simultaneously, that takes us up literally to a 98 to 99% success rate. So very highly successful with those different types of conditions. Neck, back pain, it can be a number. You can have radiating pain down the arm, going down the leg. It can just be a simple neck and low back pain. But my point is by combining this, taking this more modern approach to neck and back pain, we're able to get tremendous results. And literally, as I kind of alluded to before with the 98 to 99% success rate, only 1 to 2% of our patients end up actually going to surgery. And those that do have to go to surgery, because there is a time and a place, unfortunately, for surgery. Nobody wants to do it, but there is a time and a place for surgery. But those that do go through this proper steps, they do really well with surgery and get the relief that they need. So there's the difference between what I call old school pain relief and modern pain relief when we're talking about neck and back pain. If you need help or somebody you know needs help, have them look at our office. Go to the website that's on this video, contact our office, we'll evaluate you, we'll see if we can help you, and we'll lay out a game plan specifically for you to get you out of pain. Hope this information was useful. Have a wonderful day.